I wish I could tell you how the current COVID-19 pandemic ends. I can't. And no one else can either because it's too complicated to know just yet. And there's not one single measure that will tell us when the pandemic is over. It's not a purely scientific or medical question of when the disease falls beneath a certain level in populations. It's about many different things. And those things together make up what Dr. Jeremy Green, a historian of medicine at Johns Hopkins University, calls the social ending of the pandemic. So let's talk about how we're going to deal with many different factors, including the medical impact and the social end of the pandemic. We're going to come back to those topics many times during this podcast. The University of Rhode Island historian Dr. Eric Loomis says, the end of the pandemic is going to be ugly, and it's going to be much more about power, wealth, and psychology than it will be about the science. However the pandemic does end, though, we do know that it's going to be long and difficult. So that's why this podcast is here. The name, Inside Knowledge, means many things. First, it means increasing our access to knowledge that insiders have. Next, it means knowledge about what's going on inside our bodies medically and in public health. Finally, it means knowledge about gaining and sharing good, true, and valid knowledge with each other. If this ending is really going to be about power, wealth, and psychology as much as it is about science, then it's only fair that we all have access to the knowledge we need to have to make it through this pandemic. We have a big job ahead of us, and it's going to take a lot of time, so let's get to work. One thing I can tell you for sure, though, is that we're going to help each other get through this. King County and the state of Washington has published important information in several languages at its COVID-19 webpage. If you read any of these languages, you can click on the link in the comments to go to their page and find out important information about COVID-19.